Imagine waking up every day never knowing if your own immune system will turn against you, causing rashes, dizziness, stomach pain, or even a trip to the ER. Now imagine doctors telling you it's just stress. For millions, this is not imagination. This is Mast Cell Activation Syndrome, or MCAS, a hidden epidemic that's often misdiagnosed, misunderstood, and overlooked. Today, we're exposing the truth, busting myths, and offering real hope. MCAS stands for Mast Cell Activation Syndrome. Mast cells are like your body's internal alarm system, white blood cells that release powerful chemicals such as histamine to defend against threats. In MCAS, these cells go haywire, releasing their arsenal too easily and too often, even when there's no real danger. The result? A flood of symptoms that can strike almost any organ system: your skin, gut, lungs, heart, and even your brain. According to a 2024 review in the Health Journal, up to 17% of people may experience some form of mast cell dysfunction, but most go undiagnosed for years. Unlike classic allergies, MCAS episodes often have no clear trigger and can be far more severe. Symptoms: why MCAS is missed. MCAS is the master of disguise. Its symptoms are so broad they're often mistaken for other conditions or dismissed entirely. Here's what to look out for. Skin, flushing, hives, swelling, itching, rashes. Gut, diarrhea, abdominal pain, nausea, vomiting, heartburn. Heart, rapid pulse, blood pressure drops, dizziness, fainting. Lungs, wheezing, shortness of breath, throat swelling. Brain fog, headaches, anxiety, depression, confusion. To be considered MCAS, symptoms must affect at least 2 different body systems and often come in unpredictable flares. According to the Cleveland Clinic, MCAS can even mimic over 50 other conditions, from IBS to anxiety disorders. Myth: MCAS is just an allergy. Fact: unlike allergies, MCAS episodes often have no identifiable trigger. Blood tests may be normal and symptoms can wax and wane, making diagnosis challenging. Causes and triggers. What causes MCAS? The answer is complex and still under investigation. Genetic factors: mutations in genes like KIT and TT2 may play a role, but not all cases are genetic. Environmental triggers: mold exposure, infections like Lyme disease, and even temperature changes can set off symptoms. Comorbidities: MCAS often overlaps with other conditions such as Ehlers-Danlos syndrome, EDS, postural orthostatic tachycardia syndrome, POTS, and long COVID. Everyday triggers. Foods high in histamine: aged cheese, alcohol, smoked meats. Stress, both emotional and physical. Chemicals: perfumes, cleaning agents, certain medications. Myth: if you can't find a trigger, it's not MCAS. Fact: many people with MCAS have no obvious triggers, their mast cells simply misfire. Diagnosis: how to get answers. Diagnosing MCAS is a detective story. There's no single test. The process is systematic and often slow. But here's what experts recommend. 1. Recognize clinical symptoms. Symptoms must be recurrent, severe, and affect at least 2 organ systems. 2. Track your symptoms. Keep a detailed diary of flares, possible triggers, and responses to medication. 3. Lab tests. Blood and urine tests for mast cell mediators like tryptase, histamine, and prostaglandins. Note: these are often normal in MCAS, so normal results don't rule it out. 4. Response to treatment. Improvement with antihistamines or mast cell stabilizers supports the diagnosis. 5. Rule out other conditions. MCAS can mimic or coexist with other diseases, so a thorough evaluation is essential. According to the 2019 consensus criteria, all 3 must be met for a formal diagnosis. Typical clinical symptoms across multiple systems. Evidence of increased mast cell mediators during flares. Symptom improvement with mast cell-targeted therapy. Treatment and hope. There's no cure for MCAS yet, but management can be life-changing. Here's what works according to the latest research. 1. Avoid triggers. Identify and avoid foods, chemicals, or situations that set off symptoms. Keep your environment low in allergens and irritants. 2. Medications. Antihistamines, both H1, cetirizine, loratadine, and H2, famotidine, ranitidine. Blockers can reduce symptoms. 16. Mast cell stabilizers. Cromolyn sodium, ketotifen, and natural options like quercetin help prevent mast cell degranulation. 346. Epinephrine. Always carry an epinephrine autoinjector for severe reactions or anaphylaxis. Fast action is critical. 6. Other options. Leukotriene inhibitors and, in select cases, corticosteroids. 3. Lifestyle and daily management. Diet. Try a low-histamine diet, fresh foods. Avoid leftovers, aged cheeses, and processed meats. Stress reduction. Practice mindfulness, deep breathing, and vague nerve stimulation techniques. Sleep and routine. Regular sleep and gentle exercise can help regulate your immune system. 4. Cutting-edge research. New drugs, such as BTK inhibitors, are in clinical trials and may offer hope for those with severe treatment-resistant MCAS, according to NIH studies in 2024. Myth. MCAS can't be managed. Fact. While challenging, many people achieve significant improvement with the right combination of avoidance, medication, and lifestyle changes. Did this resonate with you? Share your MCAS journey in the comments. You're not alone in this battle. With knowledge, community, and the right care, there is hope. Remember, MCAS is real, complex, and often misunderstood. But with the latest science, practical strategies, and a supportive community, you can reclaim your health and your hope.